Hi, I'm Jody Mitchell, Director of Government Relations and Policy here at the Center for Health Affairs. With the election behind us, we need to quickly pivot to focusing on Congress coming back to DC for the lame duck session to finish funding necessary programs that are set to expire at the end of 2024. Congress returned to Washington this week following an election resulting in the transition of power with a Republican president, a new Republican Senate, and a recently called Republican House. As we enter the final weeks of the 118th Congress and look ahead to the new administration, the Center's priorities remain the same: ensuring access to coverage and care, enhancing the quality and affordability of care, supporting our healthcare workforce, and making sure that hospitals and health systems have the resources and support they need to serve their communities. Our Northeast Ohio hospitals and healthcare providers in our community are experiencing significant financial pressures that challenge their ability to provide 24/7 care for patients and the communities they serve. Increased expenses for drugs and supplies, inflation, and the mounting burden due to certain commercial health insurance denial and delay practices continue to strain community hospitals. At the same time, underpayment and reimbursements from Medicare and Medicaid do not keep pace with these mounting costs and exacerbate the challenges facing our healthcare systems. The Center for Health Affairs stands united with our local hospitals on the following priorities in the lame duck session: address the Medicaid disproportionate share hospital payment reductions. DSH payments provide essential financial assistance to hospitals that care for our nation's most vulnerable populations. Without action in lame duck, reductions will take place on January 1st, 2025. Therefore, immediate action is necessary to prevent these cuts from taking place. We need to extend the telehealth and hospital at home waivers to meet individuals where they are and to ensure access to needed health care. During the public health emergency, Congress established a series of waivers expanding access and increasing convenience in caring for patients. Congress should permanently adopt these telehealth waivers and expand the telehealth workforce. Congress should also pass Hospital and Patient Services Modernization Act, extending the hospital at home waiver for 5 years through 2029. Hospitals have embraced providing certain acute care services from the safety of individuals' homes to meet patient care for specific populations. Extending these can help support access to care. Medicare physician payment reductions need to be addressed to avoid a scheduled 2.8% payment reduction in the 2025 physician fee schedule. Provider payment adjustments, which Congress often makes at the end of the year, are being discussed alongside proposals to reform the payment system itself to make payments more reliable and potentially slow consolidation among providers. In addition to these provisions, we also support the extended funding for public health programs, including community health centers who provide critical care to underserved communities. We also support critical workforce training programs, including GME programs and the National Health Service Corps funding, as these programs expand our ability to deliver care and are essential for tackling the healthcare labor shortage. To further support our workforce, we continue to advocate for the Safety from Violence for Hospital Employees Act. This bipartisan bill, the SAVE Act, will provide federal protections from workplace violence for hospital workers similar to the protections already afforded to airplane and airport workers. While we support these previously mentioned policies, we are also mindful of the opportunity to seek cost savings and other measures to support extensions and funding needs. The Center for Health Affairs calls on Congress to reject proposals that seek to further reduce hospital reimbursements for quality 24/7 care delivered by our community hospitals. Hospitals and their associated facilities provide access to critical services that are not otherwise always available in the community, and they care for patients with more complex conditions. Payment proposals, referred to as site-neutral payment policy, that attempt to treat hospital outpatient departments the same as independent physician offices and other ambulatory sites of care, ignore the very different level of services provided by hospitals and the needs of the patients and the communities cared for in that setting. Hospitals need to have emergency standby capacity, are open 24/7 to all who seek care, regardless of the ability to pay, and have a myriad of regulatory requirements imposed on them, all adding to the overall cost of care. The Center is calling on Congress to oppose site-neutral policies. As we seek to preserve current resources to support 24/7 care in our communities, we also reject policies that seek to change and limit the 340B drug pricing program. The federal 340B drug pricing program allows qualifying hospitals and clinics that treat low-income and uninsured patients to buy outpatient prescription drugs at a discounted rate. The program is intended to help safety net healthcare providers stretch their financial resources to reach more financially vulnerable patients and deliver comprehensive services. Pharmaceutical companies are seeking to minimize the discounts for their medications. The Center for Health Affairs looks forward to working with the Northeast Ohio Congressional Delegation to advance bipartisan policies with broad stakeholder support to strengthen our healthcare infrastructure, improve patient access, and lower the cost of care.